let's go for, yeah, this is the last one, I think. Let's have a look. So last one, I think we might have, do we have a poll on this one? I think we might have a poll. Yeah, we do. Right. So, nice Hollywood, a nice Halloween theme. Okay, so we'll have a look at this case. Oh, everyone's just gone for it. Man, you guys are quick. Did you just guess or just, yeah, okay, we didn't even look at the case yet. All right, fine. So, yeah, so pyelonephritis, yeah, okay, is usually caused by E. coli. Klebsiella can cause it. Other things can cause it, but usually it's going to be E. coli that causes it. So this patient came in with fever, unknown cause, query cause. They weren't entirely sure what was happening. So we did a full CT of the chest and abdomen and pelvis. So you go through and you can see that what they've done is like a single phase study. It looks like they've done a portal venous study, because if you look at that, portal vein looks brighter than the aorta. Sometimes when you do split, you do like a CT chest and then pelvis. You do an arterial chest and then the pelvis. And this situation was just done one run through. So let's have a look at the lungs, make sure there's no consolidation or anything like that. So these lungs look okay, except they breathed a bit. Can you see? It looks like little swans on a painting. It doesn't look very pristine. So it's not the best, but you can see that there is definitely no kind of consolidative change. The lungs are very, very clear. Other clue would be if there's any lymphadenopathy. So lymph nodes would be within the mediastinum or the hilar regions. Nothing like that anywhere there. Upper abdomen. Okay, gallbladder looks okay. Yeah, more commonly in female, apparently. So yeah, E. coli infections are more commonly in female, right? Exactly. So then we have a look at the rest of the. So we look at the pancreas. So pancreas is going to be around this area. Pancreas looks okay, I think. Can't see any fat stranding. And then the kidneys, right? So adrenals are there, and you look at the kidneys, and actually they enhance normally. There's no wedge infarctions anywhere. Sometimes you get these sort of linear, hypodense sort of areas post contrast, and that would be something like pyelonephritis. I don't think that's what we got here. But when you look at these ureters bilaterally, can you see how thick walled they are? If I zoom in, look how thick walled they are. Very, very thick walled, both of them. And that's bilaterally, right? So yeah, so good. Everyone's done pretty much correct on this poll. Probably should try and make them harder, shouldn't I? Let's pan this back to the middle of the screen and then come to the very, very top. So if we come to the top, we can see, yeah, both ureters, that one there, and that one there look very, very sort of thickened. They look slightly dilated. This one in particular looks like got a bit of fat stranding around it. If you look at the fat there compared to the fat there, that looks like there's fat stranding. So this is inflamed. You can see a little bit of fluid located within this region as well. So that looks like there's definitely some sort of inflammation going on. So what this is like, it's not entirely pyelonephritis because the actual kidneys are okay, but you definitely have some bilateral ureteric enhancement or inflammation, and that can be for the same reasons, right? Tracking infection from the urinary bladder or anywhere else. The urinary bladder itself actually looks okay as well. Now, what was interesting about this case, I thought, is that when you do, you always do the usual thing. So you've got a bit of fluid within the pelvis, which may be because of the inflammation. But when you follow the bowel, and look, this is my pen is right now. Keep staying with my pen. We're on the descending colon. We'll come to the splenic flexure. They breathed a bit. Do you remember they breathed a bit? So it can be a little bit difficult looking at the transverse colon, but transverse colon is down here. We'll come down to the cecal pole. You can see a bit of fatty lips there, which therefore must mean that that's the terminal ileum. Now we're trying to look for the appendix. And actually, can you see this little tiny thing there? So if I zoom in and follow that, that goes that way, and probably goes to cecal pole, and then come up this way, this way, this way, follow it, and then it stops. So therefore, when you look at that appendix, yes, it's not enlarged, but it also looks like it's slightly enhancing, very, very slightly enhancing. So you've got to be worried there could be like a dual pathology here. There's definitely one pathology, 100%, no doubt about it. Those ureters are abnormal, 100%, because they're hyper enhancing. They look very, very thick walled. So there is some sort of inflammation there. So I would normally go with inflammation / infection. Do a urine dip, see what you think. But also, I would encourage them to also do a clinical examination of the right iliac fossa, because that appendix looks slightly enhancing to me, and therefore I would be concerned that they could also have a concurrent appendicitis, which hasn't inflamed or burst or anything like that, but maybe worth looking into as well. Right. So it looks like I have actually reached the last case slightly earlier than I usually do. Um, were there any questions? I know someone did ask me to go back to any previous cases.